In Part 1, we learned that social norms, social identity, and our leadership all contribute to the strength of our reactance and our decision to wear a face mask. Now let's explore some solutions to these problems. Many Western governments have shied away from enforcing coronavirus safety measures that concern individual behavior. They may place signs in public areas asking people to socially distance or wear masks, but without anyone around to police them, individuals are left to do what they feel is right.
Some of the initial enforcement mechanisms, which are just signs everywhere saying put your mask on, right? With the hope that people obey the signs, right? But really, I think of it as it's almost like it's like a bit of a cop-out. You're basically saying like, let's let people on their own, individual citizens, enforce this, right? Now, that's totally unrealistic. Individual citizens are not going to accost people in the subway to say like, put your mask on, because it's incredibly uncomfortable. I see it as a bit of a wimpy way of trying to enforce this, is to say like, we're just not going to enforce it at all. And the onus now goes on to the citizens to enforce it amongst each other, which is not plausible.
So how can governments encourage mask wearing and other safety behaviors without enforcing them on an individual level?
I would think that the government can do a better job than that, partly with messaging, right? And partly by depoliticizing, the mask wearing idea.
We'll look at how to improve messaging using social norms first.
When you think about social norms, a lot of people think about like what everyone is doing, but that is only part of the story. Social norms are also about what you perceive that other people think you should be doing. It's about like, I adhere to this because I think that you think I should be doing this, right? So wearing the mask is a good example. When will wearing a mask become a locked-in social norm? When everybody thinks that everybody else is judging them if they don't do it.
As we saw in Part 1, Syon and his colleagues conducted a set of surveys in the city of Philadelphia showing that although the vast majority of residents believed that mask wearing was important, residents also didn't think that their neighbors agreed with them. This mismatch between what an individual personally believes and what they think everyone else believes is actually fairly common. For instance, college students consistently overestimate the amount of alcohol their fellow students drink and how much their peers approve of excessive alcohol consumption. And research has shown that the more alcohol a college student believes other students drink, the more they drink themselves. And yet this problem has a simple solution. By telling college students the actual drinking norm on their campus, they moderate their drinking behavior to bring themselves closer to that norm. A similar solution could work to bring people closer to the mask-wearing norm as well.
As soon as you get this idea of like, well, if I don't wear a mask, people are going to think I'm a jerk. So I don't want people to think I'm a jerk. So like, I'll just throw the mask on, no big deal, right? That kind of, I guess you can say conceptualization of norms is actually critical for people to behave consistently with the norm. So how do we get people to that space? And so I was really pushing the city for messaging, essentially making that point. Like, everyone thinks you're a jerk if you don't wear a mask, period. I mean, you walk around the city of Philadelphia, we surveyed everybody and they all said, like, we don't like people who don't wear masks. So just put that in the ad, you know? I think that's the reason for doing these kind of surveys, is to try to gather collective data about like what people believe and then kind of broadcast that back to people as a behavior change tool, rather than thinking like we are the government and we can tell you what to do, which is more the reactance triggering kind of perspective.
By sharing the true social norm around mask wearing, public health messages can correct any harmful misperceptions caused by anti-maskers. And the wording of a message can also make it more or less persuasive. Using forceful language in persuasive messages like the words ought, must, or need is natural for such a dangerous and risky behavior, but tends to provoke a defensive response. Alternatively, non-threatening words like consider, could, and may leave the listener with no threat to react against, and so increase compliance to the message. The message, "You must wear a mask to protect those around you," will therefore cause more reactance than the message, "Consider wearing a mask to protect those around you," which could more effectively persuade people to change their behavior. In addition to word choice, the overall framing of the message can affect the reactance it creates. When a message is framed as a loss, emphasizing the negative consequences of a behavior, a person is more likely to feel a threat to their freedom. But a message framed as a gain, highlighting the positive consequences of a behavior, triggers reactance much less often. For example, the negative message, "When you refuse to wear a mask, you put yourself and those around you in danger," will be less persuasive than the positive one, "When you wear a mask, you and those around you are safer." So we've seen how messages can be framed to increase compliance and reduce reactance, but does the source of the message make a difference as well? In a survey, Syon and his colleagues asked Pennsylvanians how much they supported certain public health messages.
So we had a question which was basically something along the lines of, do you support social distancing policies promoted by X, Y, and, which have been promoted by X, Y, and Z, and we randomly assigned whether or not it was government officials or public health experts. And you see this pretty steady Republican Democrat support when you say it's from a public health expert, but when you say it's a government official, the gap starts to grow, essentially. So, as soon as you add that little political sprinkle the salt of politics into the concoction, you get this big gap.
And this makes sense with what we learned about social identity and leadership from Part 1. To prevent individuals from associating public health precautions with an opposing social identity, prominent social and political figures should avoid delivering public health messages themselves.
So obviously, if I was in control of messaging, that's one thing. If I was in control of the full pandemic response, I would say every politician should just get out of the picture, and there should be a briefing by the same, bipartisan group of doctors every evening. It'd be ideal if it was just the same doctor who's recognized as the COVID health czar, and ideally in a bipartisan way. So it's, basically just removed from the political spin of it.
By removing any political angle from health messaging, the public will trust the information they receive more and will be more likely to comply with safety precautions. But, of course, most people are already wearing their masks and protecting the people around them. It's really the minority of people who refuse to wear masks that we need to worry about.
For a lot of these messaging things, it's just about testing them, right? Can we test them with the key populations, right? There's people who are already doing the masking and wearing their masks and going out and doing that, but the key behaviors that we have to change are the ones who are not doing that. And so really what matters is messaging that works for those populations. And I think some of the studies that I've seen have basically tried to create a representative American population. But in a sense, I don't really care about the messaging that makes me more likely to wear a mask because I'm already wearing one. So we need to find the right messaging for the folks who are really resistant.
Until then, research suggests that to avoid triggering reactance in your audience and to make them more likely to comply with your requests, your messages should share positive social norms, use non-threatening language, emphasize the positive consequences of your requested behavior, and should be delivered by someone seen as independent from any social or political identity.